In my line of work, I work for both the National Health Service and in the private sector. In the National Health Service, I do a lot of reconstructive work, meaning that it's related to trauma, and what I also specialize in is breast reconstructions. These are mainly for ladies who has had breast cancer and they want the breast to be rebuilt, or some ladies who have breast asymmetry or a missing breast, as in a condition called Poland syndrome. So we do see a huge variety of breast-related problem. In the private sector, we still do reconstructive work, but mainly on the insurance and also cosmetic work. The two worlds are not as different as one would like to think, because both help with the surgical results and the technique. The techniques are pretty much similar, because the principle of how to look after tissue, mobilize tissues, and how to rebuild to something that appears as normal as possible applies to both reconstructive and aesthetic work. Unfortunately, with time in a National Health Service, there are more and more surgery we cannot perform simply because of the funding issues. The health service is quite tight on the budget, and therefore there are lots of surgery they are now trying not to provide for the funding. And in the private sector, we do absorb a lot of these patients who will definitely benefit from surgical interventions for deformity, asymmetry, and for things that they generally make them very unhappy. One of the things that I feel is a major crossover between the reconstructive world that help us to improve the quality of our work is fat transfer. A fat transfer is what we use to replace some of the lost volume by injecting fat that harvests elsewhere in the body. We do it a lot more in the reconstructive world when patients have lumpectomy or minor deformity. And now, as the technique has improved, we are now using it in the private sector a lot more to help with patients who has asymmetry and would not like to have too many scars. As a surgeon, we constantly need to learn and continue to improve our technique and our knowledge. We all go to different conferences, lectures in different conferences, and share ideas with our colleagues around the world. I am involved in the British Associations of Plastic Surgeons, where we have conference annually around September, and also the London Breast Meeting, where a lot of internationals lead opinion will come to London, and we can discuss and share our idea and learn from each other.